We are now viewing the diaphragmatic surface of the heart. And what we can see is immediately the inferior vena cava. This would be the right atrium. This is the right ventricle, the left ventricle, and this would be the position of the left atrium. And we can see the pulmonary veins as they enter into the left atrium. The supply to the right ventricle is provided by the right marginal artery. Remember now, the right marginal originates from the right coronary, and this is the right coronary artery wrapping around the right border and leading towards the interventricular sulcus, forming the posterior interventricular artery. We also have another anatomical variation, not abnormal, just a variation, where we have right-sided dominance forming something known as a right posterolateral artery. Adjacent to the posterior interventricular artery is the middle cardiac vein, which drains into the coronary sinus. And again, the name is shared because it, like the coronary arteries, the coronary sinus forms a crown and it lies within its own sulcus. So if we have to remove this, we will find a groove between the atria and the ventricle. And this groove is known as the coronary sulcus. Towards the left margin, we can see the great cardiac vein and its continuation into the coronary sinus. And we also have a small cardiac vein just barely visible in this depiction. At the confluence of the veins into the sinus, you would expect the opening of the coronary sinus into the right atrium.